Good evening. So the topic for my paper is comparative study of post-operative outcomes of clavicle, which was treated by nailing and plating. So clavicle fractures, as we all know, can be classified according to the Allman classification into type 1, 2 or 3. And clavicle, due to its peculiar cross-section of being very constricted and also being a flat bone, is at increased risk of fracture after following an impact on the shoulder joint. So traditionally, conservative treatments of clavicle fracture have included shoulder arm pouches, triangular slings, clavicular brace, figure of 8 bandages, etc. So the standard surgical treatment for a complex midshaft clavicular fracture involves open reduction and internal fixation using plates or intermedullary fixation using TENS nails. TENS are widely adopted as an alternative to a plate or a screw fixation, and it has been demonstrated to be a safe, minimally invasive technique that achieves primary stability and functional and cosmetic outcomes. Also, compared to plate osteosynthesis, TENS facilitates rapid healing with fewer complications. So in our study, the patients that were included in the study were patients of age between 16 to 60 years of age who had midshaft clavicle displaced fractures, a shortening of more than 2 centimeters, or a bilateral clavicle fracture. Patients who were excluded were patients under 16 or above 60 years of age who had a previously diagnosed pathology of shoulder, patients who had pre-existing fractures and fractures over 2 weeks of duration, and fracture of lateral and medial end of clavicle. So routine pre-operative assessment was done for all the patients, which included radiographs of the clavicle, the chest x-rays, as well as the routine hematogram. During the surgical procedures, the patients were divided into 2 groups. Group 1 was the patient who received TENS as the operative, the surgical management, and group 2 was the patient who received plate fixation as the management. Following the surgery, the patients were given a broad arm sling and were advised to begin early shoulder mobilization with pendular exercises on the second day post-op and active ROM exercises after a week of operation. And overhead abduction was allowed after 2 weeks of surgery. The surgical outcome following the surgery was evaluated both functionally and radiologically. Functionally, we used modified constant Morley scoring, which included both pain, strength, activities of daily living, and range of motion. And radiographic assessment included investigation of the bridging callus, obliteration of the fracture line, as well as the time taken for the bridging fracture and pain mitigation to occur. So here there is an example of a midshaft clavicle fracture that was treated through an intramedullary nail, and a midshaft clavicle fracture that was operated through plating. So this was the result that I'd like to talk about. Here. So the functional outcome as compared to, while comparing the functional outcome between the 2 modalities, there was no major differences. The constant Morley scoring for both the plating as well as the nailing was similar. However, the time of union, there's a quicker time of union was noted for patients for midshaft clavicle fractures that were treated through TENS nailing. So here we can see, so time of union in weeks that was taken for group 1 was around 10 up to 16 fractures united within 18 weeks post-op. Also, surgical complications that occurred following the surgery, a little fewer complications noted in patients who were operated with TENS nailing, attributing to the closed procedure that was done. However, fewer or more number of complications were noted, which included superficial infections, deep infections, and also the surgical scar infections that followed the plating. So these are the points that I'd like to put forth and conclude my study with. So the functional outcome, the constant Morley scoring there's no significant difference while we are comparing the functional outcome of the plating and the nailing modalities. However, faster healing and less number of surgical infections were noted in case of TENS nailing. The use of a good result came following the plate fixation was that the anatomical alignment, the rigidity of fixation, and the compression at the fracture site was better with the plate fixations. So regardless of any significant difference, I'd like to put forth that between TENS and the plate fixation, considering the secondary outcomes of early recovery and minimal complications, TENS can be a preferred treatment of choice, managing the displaced midshaft clavicle fractures. So here are the 2 studies that I'd briefly like to talk about. The first study done in University of Virginia, which was a similar study which compared the 2 modalities. This study showed similar result as the study that we had conducted, wherein the radiological outcomes of the nailing was better as compared to the plating. However, an Indian study, a similar Indian study that was done in a similar number of patients, showed results that were better with pre-contoured plating. Thank you.